If you feel like your skin's burning when you apply creams, please hear this. You're not imagining it, your skin just wants to breathe. Many patients with TSW come in with red and inflamed skin. Some put on moisturizers which help, others put on moisturizers which only worsens the situation. Why? This is Dr. Mark Chen from Chinese Doc in Singapore. I've been treating TSW for over 10 years in Singapore, and this is a common topic. Do I use moisturizers or not? When people go through TSW, especially in the Erythroderma phase, the first instinct from your derm or your GP or your family member or from Reddit even is to moisturize. So, the skin looks red and feels hot. Sometimes there's a thin layer of plasma during the super acute phase. Most times though, it is dry or even cracked in some locations. Of course, you want to try to put something on it, right? More creams. Okay, maybe not ointments, but lotions, because lotions are lighter, right? But here's what I see in the clinic. Some people, they do well. Other people, and a lot of them, just don't do well with topical applications, which is the creams. A common complaint is this unbearable burning sensation, not just itching, but heat that emanates from deep within. For those who have experienced it, I think you understand. And putting on emollient moisturizers are usually not helpful. The skin is still on fire. Okay, let's clarify again. For those suffering from red skin syndrome, some do benefit from adding on cream. In fact, I have patients who add on the heavy petroleum jelly ointments and they feel like it's good. But most of them, every time they put on the emollient, they feel like they're trapping heat even more. And this is a common reaction for those with erythroderma or red skin. When the skin reaches a stage like that, it's no longer functioning as a barrier at all. It's leaking protein, fluid, heat constantly. The blood vessels near the surface are massively dilated. Your body is trying to cool itself through the skin. It's a desperate thermoregulation response. It could be a heavy ointment, it could be a petroleum-based emollient, it could be one of your branded moisturizer creams, and still you're sealing a furnace. The heat that the body is trying to release through the skin surface has nowhere to go because you covered it. Okay, some of you say that you're not using an occlusive cream. Maybe it's a layer of something like a CeraVe or a Physiogel that's meant to moisturize. But still, it does not help that burning sensation. From a Chinese medicine perspective, this makes complete sense. In the super acute phase of erythroderma in TSW, it's a state of extreme blood heat and wind heat. The body is flooded with what we call pathogenic heat that needs to be cleared or vented and not contained. Again, there will be people who say, and this is true, they feel better with cream, even these petroleum-based occlusives. But they're usually already in the subacute phase where it's red, hot, and dry. Okay, maybe it cracks and then it's dry again, but it's not red, hot, and wet. And the wet is when it's leaking. So it's those in the super acute phase that really do not benefit from using ointments or occlusives. And then it's a little gray once you hit the subacute phase where you're red and hot, but mostly dry. And some people still do not feel so good with moisturizers. This is when you might want to think, maybe I can try not using a moisturizer. In Chinese medicine, we try to moisturize from within. And like I said in the previous video, it's worth considering. Try using Chinese herbs for 2 to 3 weeks, and you can try TCM practitioners who focus on dermatology wherever you are in the world and see if they can help you with that. Usually what helps is blood cooling herbal formulas, decoctions that clear heat from the blood. You will slowly feel like the heat in the body drops, and the heat that's emanating from the skin also slowly drops. So these herbal formulas support the body's ability to release rather than to trap. And the treatment is from within outward. And those who do well should see some kind of relief between 2 or 3 weeks. This doesn't mean never moisturize. Look at this video on lichen simplex and the ichthyosiform presentations. Those benefit from moisturizers. But in the erythroderma phase, especially the super acute phase, it may not make sense to moisturize. If you feel like your skin's burning when you apply creams, please hear this. You're not imagining it, your skin just wants to breathe. Hope you found this useful. See you at the next video.